Well, my background is in commercial dive work. I've done commercial diving for many years, and I'm also a sport diving instructor, so I've been around hyperbarics for a long time. The chambers that we use for medical hyperbaric oxygen therapy are the same chambers that you would use if you were treating a dive injury, like decompression sickness or an air embolism. Well, I think primarily we are a facility that has been designed with the patient in mind. Our pricing structure is based basically on what many people were having to pay out of pocket anyway, even if they were getting treatment for a quote-unquote covered indication. They were paying out of pocket probably as much or more than we currently charge for self-pay. You know, if people want to utilize it for something besides the quote-unquote covered indications, then we can do that, which is a big deal for the simple reason that a lot of things that they're using it for in the rest of the world aren't covered in the United States. A huge one, of course, is brain injury. We have a unique facility in that we have a very large multi-place chamber that we can treat a number of people at the same time, as opposed to treating one person at a time like most hospital-based chambers. There's a big difference when you can treat a number of people at the same time. Your staffing needs are a lot less and so on and so forth. By the economics of scale, we can simply offer it for less than most anyone else out there. We are physician-driven. So we have a physician on staff and present whenever we are treating. So we are fully compliant with regulations of Medicare. Some people that have had bad car wrecks and things like that, and it alters their entire life. They're basically stuck with the residue or the residual of a car wreck or of combat or whatever, and their whole life changes. And they're told, well, you have a brain injury, so this is the new you, and you have to get used to that. Well, you don't have to get used to that in most instances. In most instances, we can take you back towards where you were. We see veterans coming in that are taking 12, 15, 16, 17 different kinds of drugs. And at the end of 30 days, they're on maybe one. A lot of them are able to completely end their drug dependency. You know, not instantaneous, it's not a magic bullet. It takes a little time, but we see some pretty dramatic things happen. Pretty amazing stuff. Actually, probably most people, regardless of where they are, will, number one, have difficulty finding anyone who will treat them for some of the things that we treat, quite successfully. We have apartments here that are one bedrooms with full kitchen facilities, and that's available very reasonably. Someone really literally could come here from pretty near anywhere in the United States probably and stay for a month, get 40 treatments, rent an apartment for a month, and do it cheaper than they could in a hospital-based unit for just the hyperbarics. We are very personable here, frankly. I've become a relatively good judge of character, and the staff, the people that I talk to when I'm hiring them, I can kind of tell. Qualities they're looking for is compassion, you know, people that actually care about what happens to you as a patient, and people who are relatively upbeat. I mean, you know, it's pretty easy when you've had a problem with a particular injury or disease or whatever that is now into the years trying to heal it. It's pretty easy to get down, and it's pretty easy to start feeling depression and, you know, like this isn't ever going to go away, and I really don't want to be this way the rest of my life, you know. We're offering hope.